Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about gestational diabetes. Some women develop diabetes only during pregnancy, which is called gestational diabetes. The problem results in higher blood sugar levels in a mom-to-be. We believe the problem occurs for two reasons. One is the mother's body produces less insulin during pregnancy, and the second is her body can't use insulin effectively. Nearly 20% of all pregnant women are at risk of developing gestational diabetes. However, only about 25% of all cases are detected. Left untreated, gestational diabetes could lead to complications during pregnancy. Some experts recommend screening pregnant women at risk for diabetes during the first trimester. Others recommend testing all pregnant women at 28 weeks. Tests used most often are the glucose tolerance test, the GTT, or a 1-hour glucose challenge test. Risk factors for developing gestational diabetes include being over 30 years old, obesity, a family history of diabetes, gestational diabetes in a previous pregnancy, previously giving birth to a baby who weighed over 9.5 pounds, previously having a stillborn baby, or being Black African American, Latina Hispanic, Asian, Native American, or Pacific Islander. Symptoms of gestational diabetes include blurred vision, tingling or numbness in hands and or the feet, excessive thirst, frequent urination, sores that heal slowly, and fatigue. Controlling gestational diabetes is important. If left untreated, it can be serious for you and baby. Polyhydramnios, which is excessive amounts of amniotic fluid, can lead to premature labor. You may also get more infections during pregnancy. And you're more likely to develop gum disease, which can lead to other problems. Experts believe a woman with gestational diabetes may overfeed her fetus, causing baby to store more fat after birth. You may also have a long labor because baby is big. Sometimes a baby can't fit through the birth canal and a cesarean delivery is required. Treatment for gestational diabetes includes a good nutrition plan, increased fluid intake, and 30 minutes of moderate exercise every day. If these measures don't work, medication to lower blood sugar levels may be prescribed. Insulin therapy is the first choice when medication is necessary. In some cases, oral medications such as glyburide or metformin are used. If gestational diabetes occurs with one pregnancy, there is about a 90% chance it will happen in future pregnancies. Your best protection is to stay within recommended weight gain limits your doctor gives you. After birth, nearly all women who have gestational diabetes return to normal. However, if you eat an unhealthy diet after pregnancy or gain weight, you could reactivate the diabetes. You have up to a 60% chance of developing type 2 diabetes within 10 years after baby's birth. You're also at risk of developing metabolic syndrome, a collection of problems linked to heart disease. You will need to have your blood sugar levels checked within 12 weeks after delivery and every 3 years after that. It's important to follow your doctor's advice about diet, exercise, and lifestyle choices if you have gestational diabetes. It's for your good health and the good health of your baby. If you would like further information, check out our book, Your Pregnancy Week by Week. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. Looking for something specific? Check out the podcast topics list. It lists topics covered in each weekly pregnancy episode and our Let's Explore More segments. Follow us on social media for updates, new podcast episodes, and important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram.